Recording. All right, wonderful. Let me share my screen and welcome everybody to our February community meeting. My name is Chris Aviles, right, and I am the president of Garden State Esports. Garden State Esports is a nonprofit founded by teachers for students, and our mission is to help schools use esports as a platform to enjoy all of the learning, all of the competition, and all of the good stuff that goes with having an esports team. Today, we are going to be talking about injury prevention when it comes to esports. But before we get into that and introduce our speaker, I would like to thank some of our sponsors. Today's webinar is sponsored by the U.S. Army. They have been a fantastic academic partner to Garden State Esports. We've been doing a lot of work around diet, sleep, and exercise and how it affects performance. And the Army has been wonderful in not only sharing their resources, but sharing the folks they have over there with us. So they have been tremendous on that front. And we thank them, for their continued support. We'd also like to thank SHI and Intel. If you have not heard the great news, Garden State Esports friends, because of the kindness of SHI and Intel, Garden State Esports will be free to everybody for at least the next 18 months. And we have SHI and Intel to thank for that. So we thank them for their generosity as always. And then so allow me to introduce Mike. I'm going to let Mike go ahead and tell a little bit about who he is and what we're going to be talking about today. So Mike, I will go ahead and do stop sharing. So you can go ahead and tell us a little bit about yourself and what we got going on today.
All right. Thank you, Chris, and thank you everyone for attending. It's our pleasure to bring this webinar opportunity to you guys because based on what we were discussing before we even got on, getting to these esports athletes at a younger level and help develop important injury prevention strategies is really key to avoid upper extremity, low back, and spinal injuries. But yeah, my name is Mike Stano. I'm an occupational therapist, certified hand therapist with NovaCare Rehabilitation. I am one of the South Jersey hand therapy clinical coordinators in charge of the South Jersey region. And yeah, we've developed this presentation with our national group and wanted to deliver it locally so that we could introduce what therapy can do to help prevent these esport athlete injuries that are really more common than not. So thanks for having me, and I'm going to jump right in. And our objectives today is to identify at least 3 common conditions associated with esports, understanding the impact of sustained awkward positioning leading to potential injuries, identify the warning signs of pain, numbness, tingling, and upper extremity weakness of repetitive strain injuries, and identify game station designs to help minimize these injuries. And that's a key point, I think, with this whole presentation is you hear about ergonomics in the workstation design, but game station design is equally as important because of the amount of time these athletes spend on their gaming station and understanding the appropriate referral processes for therapeutic intervention to minimize injury. So we want to get ahead of it before it gets worse. When I think of an esports athlete, I think of it as a combination of like your musician and your traditional athlete based on training schedule and the amount of time one spends doing their activity. So this is a nice little journal article from the British Medical Journal on the esports athlete. There's a lot of information in this one article, and I did share it with you, Chris. So you're welcome to put it in that packet that you have available. So you can see there's a lot that goes into the health of an esport athlete in a professional stance. You'll see on the very top, it's the physical and occupational therapy part, which we're going to be discussing today, but there's also your sports medicine, psychiatry, ophthalmology, nutrition, which includes sleep, which we were mentioning earlier prior to the call, and then also athletic training specialties. So we're going to kind of focus on this top part here, looking at the therapy aspect and how we could prevent injuries from causing repetitive trauma type stuff. So just a little bit background, obviously, many of you already know this, but 72% of the athletes are between the ages of 20 and 30. As far as the professionals go, there's 30% already of them graduated college, and 62% have been playing for 2 or more years. And there's, in the literature, a bias that there's 94% males compared to 6% females. And like we were talking earlier, getting to these athletes at the younger age could help them develop more healthy approaches to the sport. This is a pretty visually busy slide, but it kind of shows the professional athlete's weekly schedule with preparation for the day, which usually includes breakfast, stretching, warm-ups, and then practice. They get a little brunch, and then they train a little bit more, whether it's exercise or actually doing gaming strategies. Notice on day 2, which is like a Tuesday, midway through the day, they have a fresh air break in meditation, which I think mental health is really key. And anyone who's in front of a computer screen for that many hours a day, just to go out there, and we talk about having a an outdoor bath, or shower yourself with the woods just to take a refreshing break and walk around, and then continuing on with more gaming and practice, and finally having dinner. So, excuse me. So the traditional professional athlete will practice between 3 and 10 hours a day. Obviously, in your school settings, they're practicing between 1.5 and 2 hours. But the most frequent complaints of these professional and college athletes are eye fatigue, neck and back pain, wrist pain, hand pain, and 40% of the college athletes aren't participating in physical exercise. And 2% have actually sought medical attention, which I thought was pretty outstanding. And we're going to go through some of the causations of injury and how to prevent them. But this is where we can come in and help you guys out a lot with consultation, evaluation, or even coming in and helping you design ergonomically safe workstations or gaming stations. So the common injuries we're going to discuss today is neck and back pain and stiffness, shoulder pain and fatigue, brachial flexopathy, which I'll explain in a little bit more detail later, cubital tunnel and carpal tunnel syndromes. That's very popular that you see in our office and heavy worker population, but very popular in keyboard use and mousing, thumb and wrist tendinitis, and also golfers and tennis elbow, which is a tendinitis condition about the elbow. So they're what we're going to review. So when we look at head and neck, a lot of these injuries occur because the gaming station might not be set up properly. So you have this forward head, slumping lower back, and being in this position for hours puts a lot of strain on your back muscles, the nerves that come down from your neck to your arm, and also cause some core fatigue. So traditional athletes work on a ton of strengthening and exercise, but it's also really important for the esports athletes to work on their core so they can maintain postures. And having that good workstation will help encourage them to have a more upright positioning. So the narrowing of the nerve openings where the roots come out at the neck will certainly cause impingement, causing numbness and tingling down the arm, and what we call compressive neuropathy. So the nerve is actually being pinched between bone and other soft tissue that could be easily corrected with a more upright posture. So in our evaluations, we're looking at this core muscular strength and fatigue issues right away, along with developing a good workstation. So along with that posture, also with the rounded shoulders and the forward head, they kind of go together and can cause shoulder pain. And the shoulder pain occurs because with that posture and the arm being forward will also cause entrapment of the tendons between the upper arm bone and the clavicle and the scapula. So with that, and causes the muscles in the neck and the upper back to overwork. So you'll have upper trapezius strain and overuse, and you might be moving your neck around quite frequently to get some relief, or move your shoulders around when you start to feel that fatigue. But a lot of that is also due to the posture related issues. And we're always going to come back to posture because that's where a lot of our upper extremity injuries kind of occur, is due to that posture, and usually due to poor game station design. So brachial flexopathy. We already talked about the posture, that slumping forward, rounded shoulders. As the shoulders come forward, there's a set of nerves that come out from your neck and run beneath the collarbone. And you could actually feel that on yourself. You could feel your collarbone and then feel that soft mass of tissue right in there. And if you move your head side to side, you might actually feel some stuff moving around. And they're the nerves that run down to your fingertips. There's a whole bunch of them that run through there called the median, radial, and ulnar nerves. And they could easily get trapped with that forward shoulder position, causing the pectoralis muscle, which is attaches to your shoulder blade and your chest wall, to actually compress the nerves right inside that chest wall area. So if you're having some pain and fatigue in that area, and the pain is referring up to your neck and down your arm, by correcting your posture, you could open that space up a little bit more efficiently. So the symptoms of upper shoulder and trapezius pain is quite different. The trapezius pain will be more centralized to the shoulder region and neck, where the brachial flexopathy type stuff is more of an anterior front of the shoulder running through the chest wall into the armpit and down the arm. So it's called brachial flexopathy because that group of nerves is actually called the brachial plexus, which is that series of nerves that I just discussed and the region where it runs through the arm. A lot of times you'll have arm fatigue and also difficulty sleeping when you have this condition, and have difficulty actually laying on that side of your body at night. So as we follow the nerves down the arm, compressive neuropathies are pretty evident with poor posture and leaning on the arms and wrists. But the first one I'm going to talk about is cubital tunnel syndrome, which is part of the ulnar nerve pathway that travels behind the elbow. And most people like to call it the funny bone. So if you ever whacked your funny bone, you realize it's not that funny when you hit it, but everyone around you laughs because you're sore and you're flailing your arm around. So basically, cubital tunnel syndrome is constant compression of that nerve and having that funny bone feel, that numbness and tingling that runs down to the hand on the small finger side, mostly the pinky and half of the ring finger. And along with the numbness and tingling, you'll also have hand fatigue. You frequently drop objects. It occurs from leaning on the elbow or keeping the elbow in that flex posture for a prolonged period of time. And your esports athlete, when they develop weakness and lack of sensation, might have lack of accuracy and inability to do those left and right key strikes that they need to do. So if you ever see that combination of symptoms and then your athlete telling you that my finger's just not hitting the key where I want it to hit, I have to look at it, that's an indication that there might be some nerve condition issue that's associated with that. So likewise, a little bit more popular and in the mainstream media is carpal tunnel syndrome. A lot of folks think that carpal tunnel syndrome is purely brought on by typing, but there's no association really with that. It's more due to constant awkward wrist positions, and it's actually compression of the median nerve at the palm of the hand. And it causes numbness and tingling in the thumb, index, long finger, and half of the ring. Like cubital tunnel, most folks with this condition will complain of dropping objects. Also, like I was saying, the awkward wrist positions of overflexing your wrist to hit keys comes back to workstation design and posture. So that will cause carpal tunnel syndrome, more likely so than just purely typing. And this is a little bit different because the carpal tunnel nerve goes to the thumb. They'll have difficulty key striking with their thumb, and they'll have weakness with this sort of spacebar pressure when they try to push down with their thumb. So moving back to the elbow, there's also some tendinitis conditions that we're concerned about, which is one is golfer's elbow. It's also called medial epicondylitis, and it's pain on the pinky side on the inside of the elbow. Quite different than the cubital tunnel syndrome, which is a numbness tingling, but this is more local pain to the point of the elbow, at the point of the elbow, where the tendons of the forearm come off. And those with this condition will have difficulty sustaining their wrist positions in gaming, also have pain with leaning on their elbow if the workstation is not proper or the chair's armrests are too high. And they'll have weakness and difficulty reaching and gripping. There's usually no numbness and tingling associated with this, but very treatable with posture correction and some therapy. So on the opposite side of the elbow, golfer's elbow or lateral epicondylitis, that's in this region of the elbow, which is more of the thumb side. And if you wiggle your fingers, put your hand over your forearms, you'll feel those muscles popping up. They're the extensor tendons that come from the elbow that go down to your hand. And usually patients with pain in that area or with that condition will have local pain to the point of the elbow, some pain down the forearm. There's usually no numbness or tingling associated with that. And they will also have difficulty sustaining that extended wrist position. So if you're gaming and your wrist is up like this, you have a higher incidence of developing tennis elbow or lateral epicondylitis. Other associated things that occur with this condition is pain with reaching forward, lifting, and also key striking. Most of the pain associated with this is with the palm down. So that's your gaming position. So if your forearm's sore, you're going to see inaccuracy, you're going to see fatigue, and they might not be able to sustain within that tournament game time to meet the needs that they want to hit. There's also wrist tendinitis that we're concerned about. It's another one of those frequent things that we see with esports athletes. And it's local tenderness at the base of the thumb, which would be right in this area right here, and burning pain that radiates to the thumb tip and then back towards the elbow. Your athletes might actually have some clicking along the side of their wrist and have difficulty hitting longer key strikes because that tendon is actually getting stuck within a tunnel. And this image actually has a really nice picture of that. This shows the inflamed tendons that are underneath the little sheath that holds the tendons close to the bone. So if you imagine you're developing thickening in that area, you're not going to be able to extend your thumb back or reach across to hit keys. And the formal name for this thumb wrist tendinitis is called De Quervain's tenosynovitis. So what can we do in therapy for all these conditions? Well, we know time is of the essence. In New Jersey, we have what's called direct access, where our patients come right into our office without a physician prescription, and they're evaluated and treated by a licensed physical or occupational therapist. We're able to start treatment more quickly because there's no x-rays involved. There's no prior office visits unless your insurance requires a referral, and we can have a quicker return to strength and regain skills and reduce pain. It's a money-saving event because you're going directly to us. We could expedite treatment, avoid opioids, and hopefully prevent surgery if we catch this stuff early enough. But however, if we find something that's a little bit more detailed and kind of not fitting the clinical picture of a nerve irritation or a tendinitis or a muscle weakness or a core weakness, we may actually recommend that that our patients will go see a physician for x-rays or some other workups just to make sure we're not missing anything. And of course, we always recommend that you guys, or the patients, and we will check their insurance to make sure direct access is actually covered. Very few insurances do not cover direct access, which is great. So when we see these athletes come in for our evaluation, we go through a subjective. We want to know what level they're at. Are they high school, college, pro, or weekend warrior? We do a pain scale, get a detailed medical history. We do a bunch of questionnaires about function. We want to find about prior levels of treatment. Many folks will go out and get their own over-the-counter splints to help minimize pain and minimize injury. So we want to evaluate that also. We want to find out their current status and height, weight, and BMI. That's also really important because, as we mentioned earlier, there's a lot of sedentary life that occurs in front of a computer screen these days. And if these athletes aren't getting up and walking around and moving, they tend to have full body weakness, which can lead to some weight issues, and we want to address that and recognize it. We'll go over their signs and symptoms so that we can tailor the evaluation to meet their needs. We want to know about their game time. How much are they spending playing the game? How much are they doing exercising and other stuff? Also, game station design. We want to know they could take pictures and bring us photos of them sitting at their gaming station. We also do tele-rehab so that we could actually do a tele-rehab session from either the gaming lab or from their home and actually evaluate the game station at a distance and watch how their posture is and make recommendations based on that also. I actually have a pretty cool story. I did an evaluation on someone during the pandemic. We were doing a lot of tele-rehab at that point, and we did our one visit in the office. She wanted to be seen, which was fine. And then we figured that it was her workstation that was actually causing most of her symptoms. And I wanted to get a good look at that. So we set up our other tele-rehab visit at her work. And she was actually able to support her phone up so I can see what everything looked like. I made recommendations right there on the spot on Friday. She came back the following week, like Wednesday it was, I think. And she said, Mike, the changes we made my work life easier on Monday and Tuesday, like nothing ever did. So I found that that was very useful and a good way to use tele-rehab, especially with this population when time is of the essence, given that your kids are in school and they have homework and a variety of other activities. So we also want to know what those other activities are. What kind of exercise are they doing? What's their school load like? And mental health screening. We don't get a real detailed mental health screen, but we want to check to see what their motivation and their level of frustration is. Because as you know, if you're not performing on the field, it's mentally taxing. So we want to tease that out a little bit and make sure they take those mental health breaks and really just recollect themselves. So a little bit more about the gaming station. There's a whole variety out there. So you have the professional gaming stations in the big arenas. You can see the picture on the bottom left. This esports athlete is leaning on his left forearm, probably his right forearm. He's fairly close to the screen, but overall decent posture, but you see a little forward head going on there. So we want to look at the workstations and really take a look at those efficiently. The bottom left, that's a pretty decent posture, a little forward head, but the arms are supported, which takes a load off the shoulders, which would hint to me that this athlete's probably not having too much of an issue. However, I'm a little bit concerned with the frequent forearm leaning on the edge of the table, which could be an issue, which we could actually recommend forearm pads. And that's a nice little quick fix. You get a little knee pad and use it on the forearm, reverse it so that the pad is against the table and the forearm, and that most times provides good relief. The top photo, your typical gaming chair. This athlete's leaning back a little bit. Posture, I can't really tell very well, but it doesn't look too bad. But I have this photo in there because it's showing a nice straight wrist position as he's on the mouse. I just hope he doesn't move too far to the right and knock over his drink. So we evaluate these athletes in standing and sitting because we want to look for spinal curvature to be as normal as possible. We're looking for that rounded forward shoulder position or the excessive lean at the low spine, which can cause issues down the kinetic chain from the spine, neck, down to the hand. So we're going to evaluate neck range of motion, spinal range of motion, also take a look at soft tissue and muscle ligaments about the upper traps and shoulders, and also the spine and other areas of the upper extremity. Sensation is the ability to actually sense light touch or deep pressure in the fingers. So depending on what the symptoms are, if it's one of those carpal tunnel, cubital tunnel, or plexopathy type situations. We want to look to see which fingers are numb and tingly at the time of the evaluation, and then also which ones bother them the most when they're doing their gaming practice or events. And of course, we look at strength measurements for the upper extremity, core, and grip and pin strength, because nerve entrapments and also tendinopathies will tend to lean towards more overall grip and pin strength. So you might have heard in some of the other traditional sports, functional movement screens. At NovaCare, we do a functional movement screen called Fusionetics, which takes a look at the whole body and gives us a really good idea on an athlete's overall flexibility, strength, and posture. So we will put our patients through this quick little 15-minute to 20-minute screen, and it's done digitally. They will get a printout of their overall score, and the program actually allows us to develop a specific program for that athlete to focus on the limitations and help overcome some of those weaknesses and range of motion losses that they have. And there's nice video components that also go along with this program, along with the home exercises that I'm going to review in just a little bit. That's part of our package. So core strength, trunk stability, huge contributing factor to upper and lower extremity issues. So we want to make sure that's part of our initial evaluation. And again, not to underestimate, but mental health is also very important. It's just as important as physical health, because you know if you're not up for it, you're not going to jump in and do something. So these athletes tend to get very frustrated with losses and not achieving the goals they want to achieve, much like a traditional athlete. I think sometimes even more, based on some of the moods and behaviors from being online and being separated from people physically. And physical injuries could lead to mental health stuff, and mental health stuff could lead to physical injuries. So we want to look at the whole picture and want to make sure a dip in performance is not due to any other cognitive challenges or emotional issues, and make the appropriate referral, of course, and discuss with family members, coaches, and athletic trainers alike. So there's physical fatigue, which is easy. Body gets tired. Poor posture will definitely lead into that fatigue issue, and lack of physical activity is a key component. And back to the emotional, we're going to look for burnout, some cognitive executive functioning and problem solving issues that might occur. There might be some lethargy and also irritability. So fatigue, physical and emotional, very important. So in therapy, we look at different modalities for treatment. You may have heard of ultrasound to help increase heat to an area to improve stretching. We do electric stim, hot packs, cold packs, paraffin wax. I didn't list all these in there, but also blood flow restriction is really good for recovery. And we see that with our traditional athletes and also general population. There's a lot of education that goes on, and especially self-care education. Ergonomics and posture position, very important. Chris, you and I were talking about sleep hygiene earlier and wellness and diet. So we want to make sure that the athletes are hitting those targets. Edema management is basically looking at swelling. A lot of times with the tendinopathies, you'll see swelling in certain areas will be an indication of injury and help guide our treatment that way. We'll also review some compensatory and adaptive strategies. Well, maybe they need to wear a splint to keep their wrist straight to ensure good position, or like I mentioned earlier, that elbow pad or small knee pad to be used at the elbow to prevent resting and that hard surface against the forearm and elbow. So encouraging rest breaks, and discuss maybe modifying the gaming schedule and coming up with a strategy that, yes, you can practice for 45 minutes without issue. So let's do some things exercise wise to increase your endurance to see if we could increase that envelope to the 2 hours or 1.5 hours, whatever they need to do. And then also finding different splints and orthoses that actually work to support the structures that we want to support to prevent and minimize injury. We do a lot of manual therapy, which includes instrument-assisted soft tissue mobilization, negative pressure soft tissue mobilization, which includes cupping, and I have a few slides on those next. Trigger point release, nerve gliding, so that nerves really don't stretch very well, but they actually glide through the upper extremity and the neck and that region underneath the collarbone. So we want to make sure those nerves are sliding appropriately, and doing different designs of kinesio tape or dynamic tape, which is shown on the right, which is dynamic tape to assist in this picture, thumb extension to minimize the pressure on those extensor tendons that we mentioned earlier, and therapist guided stretching. So we'll actually take the patients and athletes through their stretching program manually so they can know what it feels like and they can reproduce it at home, at school, or at the gaming station. So just some examples of the soft tissue, negative pressure soft tissue mobilization on the left. Shows what's called a LymphaTouch device, which is actually an electronic cup. And cupping has been very popular over the past few years, thanks to Michael Phelps in the Olympics, that was using a lot of cupping to help his body recover. The little circular picture there shows how the LymphaTouch cup rests on the skin. And if you can imagine, the skin is actually attached to the fascia underneath, which is also attached to the nerves, blood vessels, and bone, muscle, tendon tissue underneath. So influence on the skin will actually influence all the tissue underneath to improve circulation and improve healing to the area. We also do instrument assisted, which is our picture on the right. We use these silver instruments to massage soft tissue and trigger points, which also increases circulation, decreases scar tissue in certain areas that is caused by inflammatory process, to promote more range of motion and improved muscle function. So exercise activities, a big gamut of those. We do postural dynamic stabilization, because as you know, your core has to be stable as the body moves around. Core strengthening is a key component of that. Active and passive stretches, neuromobilization. So this is actually the athlete or the patient moving their arm in a certain way to glide the nerve through the tunnels. Also working on coordination and dexterity. This is huge for key strikes. So making the fingers actually work a little faster, and training with picking up little objects, and simulated typing and different kinds of strategies to help improve dexterity and coordination to get that fatigue factor to minimize. Shoulder wrist stabilization, proprioceptive exercise is actually exercising without thinking about it. So we might have our athletes standing on a wobble board while they're throwing, catching a ball, or standing on a wobble board, stabilizing their core and their shoulder while they're doing simulated typing, so that they're focusing on the typing, but subconsciously focusing on their core muscles, so that when you're actually doing an athletic event, your hands are doing what they're supposed to be doing, and your body's not, and your mind is not focusing on the core strength aspect. And also your general strengthening program, and also aerobic conditioning. So there's a lot that can be done with these athletes to put into their regular program. So at NovaCare and also Select Medical, which is our parent company, we have a home exercise platform called Strive Hub, and we have specific esports programs for certain conditions that is specific to those athletes if we need to focus on certain things. And you can see here we have one for core and lower extremity, chest and torso exercises, wrist exercises, elbow, cervical, and also hand, just to name a few. So when we develop these programs with our patients and athletes, they actually have access to these online, so they could have them on their phone and watch the videos and follow our instructions virtually, which is very helpful for this population because they love to do things digitally. So I kind of touched on splints earlier. On the left, you'll see, an Xbox controller, someone using an over-the-counter prefabricated type splint that has metal bars on the palm side of the hand and the back side of the hand. So a lot of times, over-the-counter splints are made for all but fit none. Sometimes, like the thumb strap might be in the way of this gamer hitting the keys and all the buttons, but also it is cumbersome to the hand. They might not be able to hold a controller like they want to, or if they're on a keyboard, maybe that splint is actually in the way. So I just want you guys to know that there's custom options for pretty much any injury that we deal with. So we use solid thermoplastic material that melts at about 150 degrees and custom design splints for our patients so that they could function more efficiently. And as you can see here on the right-hand side, those fingers have a ton of movement potential. The thumb's really not restricted. And if there's a certain keyboard they use, we could have them actually bring in their devices and fabricate splints to meet the demands of those different tools that they use. So there's a lot of variability with the custom splints that the prefabs don't provide. So unplugging, tips for improving mental health. We'll go over some of these with our patients. Doing a forest bath, take a walk in the woods kind of thing. Yoga, very important. It's good for centralizing the mind and also the body. And really socializing without discussing gaming. I know it's hard for some, but it's really important just to break away and maybe go to Applebee's for half appetizers on a Friday night to clear your mind and just to move on, maybe even watch traditional sports on TV or go to a game. And during pandemic times, it's kind of hard to meet socially, but encourage it with safe social distancing and appropriate CDC precautions, of course. So the American Society of Hand Therapy actually has preventative tips on for esports athletes. And I'm not going to go over these specifically. Chris, if I haven't already sent them to you, I can send you the PDF version that's from the ASHT website, which are nice little reminders for you guys to take home to monitor the height of the monitor, taking breaks, using a neutral grip, which is keeping your wrist in a straight position as opposed to being overly flexed or extended, and just different helpful tips just to keep out handy, and maybe you can hand these out to your athletes. So take home points. Our role is education and prevention at this point, and eventually getting into some outreach when we could maybe join you guys in your gaming labs to review postures and even come in and do little seminars for your athletes at the school level locally, which would be actually fun to do, and deliver something like this a little bit more in live than virtual. But the treatment of these athletes is to get them back in the game, just as a traditional athlete. And the key to prevention is knowing the cause of the problem. So, they say about an ounce of prevention. So that's why we're coming here today, is to kind of alert you guys, if you haven't already heard, about potential injuries of these athletes. So this is where you can reach me if you have any questions. You can reach me at Mike Stano or mstano@novacare.com. This is my phone number, 609-576-7510. And I appreciate your time and attendance tonight and taking the interest on these preventative injuries. And I open it up for questions.
So I know, Mike, one of the questions I had is thinking about, again, the preventative nature of what we're trying to do as esports coaches. What would you say for our middle school and high school esports athletes? What are the one or two most common injuries that you're seeing, or at least imagining that some of these kids may be suffering from?
Neck pain and shoulder fatigue.
And if I was, well, I am the coach of an esports team, what can I work into? What one or two stretches can I work into practice that would help with those one or two types of injuries or discomforts?
Yeah, Chris, I would start with posture. I'd have them take a break and have them sit up real tall, feet flat on the floor, right? And I tell my patients, if you imagine a string pulling the crown of your head to the ceiling, so they're not going to look up or tilt in any way, but they're just going to lengthen their spine, right? So get that good core posture, and then also reaching out with their arms straight. I'm going to back up for a minute. So they could reach out with their arms straight, do a stretch down with their wrist, do a stretch back with their hand, 3 to 5 second hold, because you don't want to hold muscle tissue too long. It actually congests the circulation in the muscle tissue and tendon tissue. So even more dynamic stretching also, with both hands out in front, both hands out to the side, and then do like a snow angel type thing with that good posture and move real slow. Hands behind the head, hands behind the low back, and then also maintaining that posture, twisting from the hips, left to right, and then also, reaching to the floor, touch, and then even arch back over the chair.
Awesome.
That's more than two.
No, that was all really good. And I think the other question I had as I was listening is, having coached traditional sports for a long time, I know sometimes that it's important to kind of shut a student down, give them a break, let them rest when they're seeing injuries, especially from overuse. Is that something you would recommend? And what is a timeline when it comes to like that? I know it's maybe different for every kid, but typically from some of those most common issues, maybe carpal tunnel or something like that, how long should that student rest typically?
Yeah, so I would look at it like if they have symptoms at night when they're sleeping and it wakes them up at night and they can't do too much during the day without those symptoms coming on, that would lean to me that would be a longer duration shutdown time.
Mm-hmm.
And I would recommend for a carpal tunnel is for that student to actually wear a wrist splint at night so that they're not sleeping like this, because that will put pressure on the nerve. If they're only having symptoms that occur after 2 to 3 hours of play, then I would limit their play to about half that time. Take a break, do some stretches, maybe stop for 30 minutes, and then see how long that next gaming session was before they had symptoms again. So if they're having intermittent type stuff where it comes and goes, but you're seeing it like it's coming on at 2 hours, 2 hours, 2 hours, I would shut them down for a couple days and then start them at an hour, see what their symptoms are. Then the next day go to an hour and a half. Then the next day go to 2 hours. There's no real guidelines for this, like a thrower. Like if you're looking at a pitcher, you're looking at shutting them down completely for a while and then incrementally bringing them back with long toss and things like that. So I would definitely want to see if the symptoms are intermittent and only during gaming. Is it happening in schoolwork with writing? And now with computer use, online type stuff. How long does it take for these symptoms to come, and how long does it take the symptoms to go? I mean, that's a pretty general answer, I know, but sort of a guideline.
I mean, it sounds like something when it comes to if it bothers them, sleeping at night or during the day during regular school activities, right? That to me as a coach would be kind of like a red flag and something to address.
Right.
So
Exactly.
That's good to kind of set those guidelines for some of the coaches in Garden State Esports that are maybe new to coaching. Kind of what to look for. When something goes past being hurt to being an injury, that's the thing. I remember being coached when I was an athlete and then, speaking to my athletes about the difference between being hurt and being injured. And so that sets some good guidelines, to kind of help us make sure we're doing what's best for our kids. That's fantastic.
Right. And then if you notice that they're saying, oh, I don't have it, the symptoms are gone, I'm fine, I'm fine, I'm fine. And then if you're seeing a decent reduction in performance, it's kind of like your football running back who has a sprained ankle and can walk fine, but can't cut very well and could hide it. If you see that, their 4D speed is down and they can't perform in practice in certain ways, you're like, okay, there's something going on here.
Yeah.
Let's sit down and talk about this a little bit more, because kids are good at hiding stuff.
Yeah, absolutely. Anybody else? Questions?
I have a quick question. I think I wrote it down. It was on page 27. I think it was a screenshot of your website with the exercises. Those won't be made available unless they're an actual patient or someone in recovery, right?
Correct.
Okay.
We do have some stuff coming out, Sarah, that we can probably fill that void. Our SEL curriculum that we've been working on, we're about a week away from releasing. There's a bunch of activities around stretching and stuff like that. And we've made some videos as well. So I think we'll be able to fill that void for you.
Okay, great. Thank you.
Yeah, absolutely.
I have a question about eye fatigue, because some of my kids are, they've been on school all day on the computer, and now I'm having them sit in front of the computer more. I've noticed that, like, my gaming glasses, they say not for under age 12. And I have some kids that are under age 12, so I don't want to recommend them to get, the glasses. But like, is there exercise, like, what can they do?
That's a really good question. That's a good ophthalmology question. I can't say I ever really did eyeglass or eye exercises.
Yeah, I've seen videos on YouTube about like eye exercises, like looking at different points on the screen and stuff like that. Do you think that would help? Like,
yeah, I mean, there's some cognitive therapists that do that if someone has a head injury or concussion. They'll definitely do exercises like that. Also, there's some things that you can do with beads on a string. So if you tie the string on a doorknob and have them bring the beads closer and further away, they could actually exercise their eyes that way. So you're doing convergence and divergence.
Okay.
And then also even simple things, you could make something up on a piece of paper with dots and just have them look from side to side. We do that with some of our concussion patients, look at A, look at D, look at C, and just the eyes go in diagonals in different directions. But yeah, with the eye fatigue type stuff, I would also watch, because they would be like those posture folks who are moving closer to the screen or adjusting their head in a certain way.
I only have 2 kids that are on PC, and the rest are sitting on couches with a switch in their hand. So I'm pretty sure they're holding it this close too. So
right.
Yeah, I just haven't been in the same room as them before, so I don't really know what they're doing yet.
And that might be a good fix too, is to get them on a PC and have them in a good position.
We're hopeful next year we're allowed to be in the school.
Yeah, there you go.
So that we can get them in somewhere where we can keep an eye on them. But we have been doing hand exercises. We've been doing exercises on our shoulders, because I actually had surgery on my hand for tendinitis from gaming. So
there you go.
Those people. So yeah. And I do have to tape my shoulder sometimes from gaming, because I still game a lot. But yeah, so I make sure that they exercise. But I just want to make sure that they don't end up like me.
Right.
So yeah.
No, it's almost like preaching to the choir, right? I remember coming home from work and banging out a whole season of NHL, and then waking up the next day after 2 hours of sleep. And
there you go.
Yeah.
That's a long time ago, though.
Oh no, I'm still an MMORPG player. So
wow.
it used to be 8 to 10 hours a day, and now we're down to like 4 hours a day. So yeah, it's a job. It definitely is a job. But thank you.
Sure.
Mike, we have something in the chat from Nick.
I saw that.
College and career wise, is this an official specialty in medicine or something you and your colleagues have developed over time? And that's something we try to do a lot with Garden State Esports, is expose kids to careers and possible college majors in and around the esports ecosystem. So, maybe talk a little bit about your background, and then as Nick said, is this something that you guys have developed because you saw a need, or is there an area of specialization when it comes to this kind of stuff? Yeah,
so my background, I graduated from Temple University in 1993 with a bachelor's in science for occupational therapy. Some years later, I got my certified hand therapy degree and did some training courses throughout my career that actually led me to this. But there's really no esports specialty. It's actually what we call, in our company is it's a like a line of business or a specialty program. So we have specialty programs in hand therapy, concussion, cancer rehabilitation, which a basic degree in occupational physical therapy will give you the springboard to develop these other skills later in your career. So yeah, it's like something that I was interested in when it was presented to me. And I said, yeah, I think I could be good at this, and researched it. And if you look in the journals these days, there's really nothing out there that's written before like 2017.
Wow.
2015, maybe, with a hint towards esports athletes. There's a lot of stuff in there about computer and ergonomic type stuff and typing. But as far as this specialty, or it's very specific. And the physicians that actually guide like the Fusion and the team in New York, I'm spacing on the name, but they're sports medicine physicians typically, or physiatry.
Nice. Very cool. Any other questions, friends?
Yeah, Mike. I know you're talking about things like hand position on a keyboard and wrist alignment. What's your take though on using the little game pads instead of a full keyboard? So that, because
Yeah,
I just feel like they're
it's more of a neutral position. So I'm not too worried about that. I'm more worried about like the static elbow position for those.
okay.
Yeah, to kind of build off that, I know like for my school, we're more than likely going to be building an esports lab, looking forward to next year. Are there any like guidelines for like desk height, monitor height, how far away from the front of the desk the monitor, keyboard, mouse should be, things like that?
Yeah, there is. Usually the chairs and such adjustable are the best. So you want, your gamers, like their feet flat on the floor, their knees at 90 degrees, their hips at 90 degrees, monitor height with the top of the monitor at eye level or just above, so that they're not doing a lot of the heads up and heads down. And this distance is about 2 feet.
Okay.
And you could actually look up some office ergonomics. There's a lot of stuff on office ergonomics, which is very similar to what you're talking about, because the game stations are a lot like your computer workstation.
Right.
So even stations that can bring someone up in the standing and have that flexibility would be pretty cool too. Because at the office I sit, but I also stand and have an adjustable table that I can move around.
Okay.
Just for that purpose.
Yeah, and I think, Mike, you had said that you'll have, we'll share out that handout that kind of talks about some of that stuff.
Sure.
So we'll share that out with the video. Yeah, good question.
Great. Yeah, all good questions. Thank you.
Awesome, friends.
Well, thanks.
Yeah, Mike, thank you so much. It was fantastic. Definitely learned a lot, and I think Garden State Esports members and beyond will enjoy watching the video. We have your contact information so we can follow up if we have any questions. And yeah, I think it'd be cool if we can do some more workshops together, maybe involve some kids and stuff like that, and make sure that we're doing everything that we can as coaches to keep our kids safe and healthy. So thank you so much. And
yep. Thank you
for coming. I will share my screen real quick to send us out of here. But again, if anybody has any questions, whether you're within Garden State Esports or you are outside of Garden State Esports, you can hit me up at chris@gardenstateesports.org. We will be having these webinars again once a month for the foreseeable future. We'll be back on, I think, March 2nd or 3rd, where we will start to introduce our SEL curriculum, where we talk about not just about stuff that Mike talked about today, right, but also skill building around teamwork and leadership and communication with students, as well as helping them navigate digital culture and some of those situations they might find themselves on the internet or while gaming, and how to best handle those. So again, thank you to Mike and thank you to everybody who came out. We definitely appreciate it. And I hope everybody has a wonderful night. Thank you, friends.
Thank you. Have a great night.
Take care.